This talk is about embryology of the nervous system. It is the first part in a three-part series. This talk will be conducted using a question and answer format. The first question is: the study of CNS embryology can be broadly divided into two periods. One involving a relatively similar process occurring at all levels of the neuroaxis, and another one involving different processes at different levels of the neuroaxis. A true, B false. These photographs depict the transformation of a neural plate into the neural tube, a process called primary neurulation. The appearance of a neural plate is considered the beginning of CNS development. This is followed by the formation of a shallow canal, then the canal deepens, and finally the neural tube is formed. The formation of the neural tube does not occur simultaneously throughout the length of the embryo, yet the process itself is similar at every level. Hence, it can be studied as a single event in a global fashion. All processes occurring after neural tube formation are not only temporally different, but the process itself is different in each region. Hence, they need to be studied individually. So the answer to this question is true. Next question: which of the following is not a consequence of the regional disproportionate growth of the neuroectodermal plate? A. The formation of the neural tube. B. The formation of the central canal. C. The ectoderm retains continuity. D. Neural crest progenitors separate from the neuroectodermal interface. And E. Notochord involution. In this frame, you can see represented a three-layer embryological structure with the notochord. This composition is characteristic of a mid-third week embryo. Under the influence of substances released by the notochord, the ectoderm just above the notochord thickens, forming the neuroectoderm or neural plate. The substances influencing this change include noggin and chordin. Once the neural plate is formed, it undergoes differential growth. The expression of the differential growth is such that the neuroectodermal cells at the edge of the plate become taller than those at the rest of the plate. This event produces the neural folds. The neural folds transform the neural plate into a shallow canal. This shallow canal is present at the end of the third week. In this new frame, I have introduced two arrows. The area indicated by the arrows, by virtue of their position, are called the ectoderm neuroectodermal interface area. As shown in this figure, the mesoderm under these areas rises. The raising of the mesoderm further elevates the edges of the canal, and as this is happening, some cells in the ectoderm neuroectoderm interface become neural crest precursor cells, whereas those more centrally located in the neural plate, bracketed by the magenta line in this frame, become neural tube precursor cells. After this transformation, the growth at the edges of the neural plate continues. until both sides of the neural plate come together and fuse. This process, as we previously mentioned, is called primary neurulation. Primary neurulation has 4 immediate consequences. First, the transformation of the neural tube precursor cells into neuroepithelial cells. Second, the development of a central canal flanked by neuroepithelial cells. Third, the separation of the ectoderm from the neural tube by mesenchyma. And fourth, neural crest progenitor cells separate from the ectodermal-neuroectodermal interface and are now surrounded by mesoderm. In this figure, you can see the neural tube represented as a single layer structure. But soon, due to multiplication of neuroepithelial cells, it becomes a multi-layer structure, as you can see in this microphotograph. So the answer to this question is E. Next question. Which of the following is not true? The wall of a recently closed neural tube consists of neuroepithelial cells. B. Once neuroblasts form, they lose their ability to divide. C. When neuroepithelial cells cease to produce neuroblasts and glioblasts, they differentiate into microglia cells. D. Neuroblasts or primary nerve cells arise exclusively by division of progenitor cells of neuroepithelial origin. In this photograph, we can see the neural tube, notochord, and mesenchyma. The mesenchyma is surrounding the neural tube. I have selected this region in order to present an illustration of the area. This area is made of cells which I have illustrated in this frame. These cells are called neuroepithelial cells or radial glia cells. These cells can regenerate and also produce lineage-specific progenitor cells. Progenitor cells with neuronal lineage go on to produce unipolar neuroblasts that soon become apolar neuroblasts. Soon after, they become bipolar neuroblast. The processes are the primitive dendrite and primitive axon of the future neuron. These cells then develop many other dendrites and are called multipolar neuroblasts and go on to become neurons. In addition, the genitor cells of glial lineage will generate glioblasts. Glioblasts generate astroblasts that themselves generate protoplasmatic astrocytes and also generate fibrous astrocytes. Glioblasts also generate oligodendroblasts. They ultimately produce oligodendrocytes and oligodendrocyte precursors. Now we need to go back to the neuroepithelial cells. These cells, when they become old and stop producing lineage-specific progenitor cells, turn into choroid plexus epithelium and ependymal cells. Now let's go back to the microphotograph. specifically to the mesenchymal tissue. It is from this tissue that mesenchymal cells introduced in the CNS, in the walls of the vessels, become microglia. I have now added a magenta asterisk by the side of some cells. These cells are the progenitor cells, protoplasmatic astrocytes, fibrous astrocytes, neuroepithelial cells, ependymal cells, choroid plexus epithelium, and oligodendrocyte precursors. These cells are able to divide and to regenerate. I have now added a green asterisk by the neuroepithelial or radial glia cells to indicate that they are pluripotential cells. So the answer to this question is C. Next question. Which of the following is not true? A. Asymmetric cell division can occur in neuroepithelial cells and progenitor cells. B. During asymmetrical cell division, a cell generates a copy of itself and one daughter cell. C. Neuroblasts have the ability to replicate. D. Astrocytes preserve the ability to divide in the adult central nervous system. D. During symmetrical cell division, a cell generates two copies of itself. We will spend a few minutes going through this figure. Neuroepithelial cells that, as you know, are often called radial glia cells can undergo symmetrical division and produce two copies of themselves that retain their ability to divide and their pluripotentiality. Neuroepithelial cells can also undergo asymmetrical division, producing a copy of themselves that retains all the capacities of the mother cell and a progenitor cell. Progenitor cells are not pluripotential, and unlike the neuroepithelial cells that can divide many times, progenitor cells can only divide a few times. Progenitor cells are lineage specific, meaning that they are either destined to ultimately produce neurons or glia cells. Hence, they can undergo symmetrical division and produce two copies of themselves, or undergo asymmetrical division and produce a copy of itself and a daughter cell that is either a neuroblast that is no longer capable to divide, or a glioblast that retains the capacity to divide even after reaching maturity. So the answer to this question is C. Next question. Which of the following neuronal processes occurs last? A. Proliferation. B. Migration. C. Organization. D. Synaptogenesis. In the classic anatomical embryological literature, the central nervous system has 5 divisions: the spinal cord, the lower brainstem comprising the medulla and the pons, the upper brainstem, the mesencephalon, the cerebellum, and the cerebrum. As you can see in this new frame, I have added in the x-axis an arrow implying the passage of time till 38 weeks. Thus, the direction of the arrow indicates a gain in maturity. The broken line I have just introduced indicates time of fertilization. I will now go on to illustrate the time span required for each of these divisions to reach, relatively to each other, the morphological maturity found at 38 weeks after fertilization. Thus, the time it takes the spinal cord to look the same as it will do at 38 weeks is less than the time it takes for the lower brainstem to do so. The time it takes for the lower brainstem to look as it will do at 38 weeks is less than the time it takes the upper brainstem. The time it takes for the upper brainstem to look as it will at 38 weeks is less than the time it takes for the cerebellum. And the time it takes the cerebellum to mature is less than the time it takes the cerebrum to look so. Hence, significant morphological and maturational changes in the spinal cord and when the major morphological and maturational changes in the cerebrum have barely begun. As we previously mentioned, early in development, there is a short period of time that maturation of all CNS divisions is relatively similar. This period courses from the appearance of the neuroectoderm at about 8 days after fertilization and ends with the formation of the neural tube. In this frame, the beginning of this process is marked by the introduced red broken line and the end by the just introduced white line. During this period, proliferation of neuroepithelial cells is very active and their division is symmetrical, thus forming a rather uniform stratified neuroepithelial tube, but neither progenitor cells, neuroblast, or glioblast are present. After this period, progress becomes quantitatively and qualitatively different in each embryological division. This difference becomes more marked as time advances. Let me expand on this point by using neuronal elements as an example. Neuroepithelial and progenitor cells destined to produce mature neurons proliferate, then migrate to their destined locations and organize. The timing of these phases in the spinal cord are depicted in this frame by the introduction under the arrow labeled spinal cord color lines matching the phases: blue for proliferation, magenta for migration, and green for organization. As you can see, the duration of each of these phases is rather short, and the whole process ends relatively early. Yet, it is important to stress that the termination and beginning of each of these phases, that is, progression, migration, and organization, is not as well delineated as I have represented here. In reality, the delineation is less sharp, and one phase blends with the other, as I have attempted to show in this new frame by blending the transition between the solid colors. The same phases with the same blending pattern takes a little longer in the lower brainstem, little longer in the upper brainstem, longer in the cerebellum, but in addition, during the organizational phase of most cerebellar cells, a second wave of proliferation, migration, and organization occurs. This corresponds to the external granular layer of the human cerebellum, where the highest cell proliferation rate occurs between 28th and 34th weeks of gestation. In the cerebrum, the sequential progression of phases so well established in the spine, lower and upper brainstem is only respected by proliferation. This phase is only present initially and it persists up to 32nd week of gestation. The phases of migration and organization seem to occur at different times in different regions of the cerebrum, probably related to the distance neurons have to migrate to reach the intended targets. Hence, in the cerebrum, while one area is organizing, another area is undergoing migration. In addition to proliferation, migration, and organization, we also have a fourth phase in neuronal element central nervous system maturation, which we have not yet addressed. This phase is called synaptogenesis. In the cerebrum, synaptogenesis occurs late in the overall maturational journey of the multiple cerebral structures, and in certain areas goes on after 38 weeks post-fertilization and likely for many years. Synaptogenesis also occurs in the cerebellum after 38 weeks post-fertilization. In the upper brainstem, lower brainstem, and spinal cord, synaptogenesis takes place relatively early in development. So the answer to this question is D. Next question. Dorsal induction starts at the dash region: A. cranial, B. midbrain, C. cervical, D. thoracic, E. lumbar. Dorsal induction includes the formation and closure of the neural tube. Closure of the neural tube progression has been compared to closing of a zipper. It starts at the level of the future neck in the cervical region, but as the cervical closure advances rostrally and caudally, other areas not contiguous with the initial region of closure start doing the same. The second of these regions is in the forebrain, which also advances in both directions. Soon, this process closes most of the cranial region and the cervical and thoracic spinal regions. At this stage, the neural tube has an anterior and a posterior neuropore. The anterior neuropore closes first at about 25 days. The location of this final closure is the lamina terminalis. The posterior neuropore closes in about 3 days later in the lumbosacral region. So the answer to this question is C. Next question. The stages of embryo development, Carnegie stages, were named after A. medical doctor, B. philosopher, C. physiologist, D. philanthropist. This is a photograph of Andrew Carnegie. He was involved in the steel industry and made millions. Then he became a philanthropist, and most of his donations went to science. This Washington building was constructed with the money he donated, and with his donation, several scientists were brought from different universities to work on embryology. Among these scientists were Franklin P. Moll and George L. Streeter. They formulated a classification of embryos in 23 stages that, in honor of Andrew Carnegie, was called the Carnegie chart. The chart is about human development during the first 8 weeks of life. It is based on the greatest length of the embryo on the estimated post-fertilization age when the measurements were done. It uses, as we previously mentioned, the term Carnegie to define these stages. and the chart defines 23 stages. As you can see illustrated here, Carnegie stage 1 refers to the embryo at fertilization, which was considered when human life begins. This is day 1. On day 1 post-fertilization, the embryo is about 0.1 millimeter, and it goes to a stage 23. At this time, the embryo is about 3 centimeters, which corresponds to day 56, the last day of week 8. This chart I have introduced should not mean much to you at this time, but hopefully it will pretty soon. I will use it to tell you about the nomenclature used to age pregnancy. Here I am indicating to the first day of the last menstrual period. Pregnancy duration, when measured from this date, is referred to as gestational age. Here, to the presumed or known day of fertilization. When measured from the presumed date of fertilization, we talk about conceptual age. When measured from the known date of fertilization, we talk about fertilization age. The first row of numbers indicate trimesters of pregnancy. The second row, the gestational age in months. The third row, the gestational age in weeks. Notice that the number indicates the end of the week. So when we talk about 2 weeks gestational age, we're talking about 14 days gestational age. The third row refers to conceptual or fertilization age in weeks. In this last interrupted row, we are indicating the 23 Carnegie stages. The last Carnegie stage is 23. This stage coincides with the last day of the 8th week conceptual or fertilization age. The first 2 weeks after fertilization are called germinal period. From the 3rd to the end of the 8th week is called the embryonic period. And from the end of the 8th week till birth is called the fetal period. Some authors refer to the first 8 weeks after fertilization combined as the embryonic period. So the answer to this question is D. Next question. Which of the following is not true? Embryological morphological development of the CNS A is initially similar in all areas. B is later dissimilar in all areas. C occurs simultaneously in all areas. D is not synchronous in all areas. Please take a few seconds to look at these images. Notice the similarity between the lumbar and cranial regions at stage 10 and the lack of similarities between the same regions, that is between the lumbar and the cranial regions at stage 23. But also notice the relative similarity in the lumbar region from a stage 10 to a stage 23. Now notice too that the cranial region looks very different at the stage 10 and at the stage 23. Appreciation of these facts will allow us to draw forward core concepts regarding CNS embryology. Initially, CNS development is rather similar in all areas. Later, dissimilar in all areas. Once formed, some areas change little. Once formed, some areas change lots. So the answer to this question is C. Next question. Which of the following structures is not considered a primary cranial vesicle? A. Prosencephalum. B. Mesencephalum. C. Rhomboencephalum. D. Myelencephalum. At 25 days, we can already see that the rostral part of the neural tube is growing faster than the caudal region. And since the growth in the rostral part is different at certain segments, bulges called vesicles are formed. They are all labeled using the postfix of encephalon. So we have the prosencephalon, mesencephalon, and rhomboencephalon. These structures are called the primary cranial vesicles. Below, with no apparent segmentation, we have the spinal cord. So the answer to this question is D. Next question. Which of the following embryonic flexure is the first one to appear? A. Mesencephalic. B. Cervical. C. Pontine. This is the position of the embryo on day 25. The disproportionate growth and position of the prosencephalon provokes a weight-resistant imbalance in the embryo that causes the embryo to bend at the level of the mesencephalon. Thus, the mesencephalic flexure appears with a relatively stiff angle. This flexure adds pressure to the structure of the embryo, especially at the spinal cord rhomboencephalic junction, and the embryo bends again at this location. This flexure is called the cervical flexure. So the answer to this question is A. Next question. Which of the following structures retains its primary vesicle stage name? A. Prosencephalon. B. Mesencephalon. C. Rhomboencephalon. D. Myelencephalon. This cartoon depicts the morphological configuration of a 28-day-old embryo that is at the end of the 4 weeks. Now I have introduced a new structure, the caudal eminence. I will talk about this structure more in the future, but for now let's just say that it is a collection of cells that form a dense mass at the caudalmost region of the embryo. I have now introduced another figure somewhat reminiscent of the first one. This is how the embryo looks on day 35. Notice that the prosencephalon of the 28-day-old embryo now has developed into the telencephalon, which is a double-tier structure. Here I am pointing to the left telencephalic vesicle, here to the right telencephalic vesicle. In addition, from the prosencephalon, we have the diencephalon, to which I'm indicating in this frame. The mesencephalon of the 28-day-old embryo retains its name in the 35-day-old embryo, and more or less it has the same configuration. From the rhomboencephalon arises the metencephalon, where you begin to see the rhombic lips that will contribute to the formation of the cerebellum, in the myelencephalon. This system of vesicles is called the secondary cranial vesicles. Below these vesicles we have the spinal cord and the caudal eminence that it is now incorporated into the spinal cord. So the answer to this question is B. Next question. Which of the following embryonic flexure is the last one to appear? A. Mesencephalic, B. Cervical, C. Pontine. As you recall, at age 25 days, the weight of the prosencephalon bends the mesencephalon, producing the mesencephalic flexure by day 26, which forms a rather acute angle, as you can see in this frame. This redistribution of weight at the rostral end of the embryo, as you know, produces a second bend at the junction of the rhomboencephalon and the spinal cord. This occurs by day 28 and is called the cervical flexure. The angle of this bend is not quite as acute as the angle of the mesencephalic flexure. By day 35, probably related to the weight of the alar region of the metencephalon and physical constraints, the pontine flexure appears. So the answer to this question is C. Next question. The cavity of the mesencephalon becomes the A. Lateral ventricle, B. Third ventricle, C. Aqueduct of Sylvius, D. Orifice of Monroe, E. Fourth ventricle. So far, we have represented the 28-day-old embryo and the 35-day-old embryo from their lateral view. These embryos can also be twisted from the lateral view to the frontal view, as you can see in this frame, represented in a face. Here you can see a 25-day-old embryo in the lateral position and bended. The straightened frontal view is achieved by physically raising the rostral end of the embryo and then turning it, as indicated by the arrow. Doing so, we will get this view. This view would allow us to better see the cavities inside each of these regions. So if we cut, as indicated in this frame, in a coronal fashion, we would see, as the cut advances caudally, more and more cavities enclosed by different structures, till you can see them all. You can do the same with the 35-day embryo, as you can see in this figure introduced in this frame. I have now indicating the optic black codes and the rhombic lips in the 35-day-old embryo for orientation. Now look at the prosencephalon. From it develops the telencephalon and the diencephalon. Some authors identify the rostralmost region of the neuroaxis as being of diencephalic origin. We do not. Now look at the mesencephalon, which retains the same name and undergoes minimal external changes compared to other vesicles. From the rhombencephalon develops the metencephalon and pilencephalon. From the spinal cord develops the cervical, thoracic, lumbar, and upper part of the sacral region, and from the caudal eminence develops the lower sacral and coccygeal regions. The integration of the caudal eminence to the spinal cord is called secondary neurulation, about which we will talk later. Now we will proceed with the labeling of the cavities of each vesicles. The labeling is achieved by changing the postfix encephalon for the postfix seal or cili, and making other minor linguistic adjustments, as you will see. So the cavity for the prosencephalon is called the prostocele. The cavity for the mesencephalum is called mesocele. For the rhomboencephalum, rhombocele. For the spinal cord and the caudal eminence, the name changed a little, so it is just called the central canal. On day 35, the names of the cavities corresponding to the vesicles are constructed in the same fashion. The cavity of the telencephalon are called teloceles and go on to form the lateral ventricles and the anterior-most region of the third ventricle. The cavity of the diencephalon is called diocele, a rarely used term. This cavity becomes the larger part of the third ventricle. The cavity of the mesencephalon is called mesocele and goes on to form the aqueduct of Sylvius. The cavity of the metencephalon is called the metacele, and this cavity, in conjunction with the cavity of the mielencephalon that is called mieloceles, form the fourth ventricle. The cavity of the spinal cord and caudal eminence retains their names, so they are called central canal of the spinal cord. So the answer to this question is C. Next question. Which of the following is not true about ventral induction? A. Occurs between conceptional age of 5 and 10 weeks. B. Encompass prosencephalic cleavage. C. Encompass mesencephalic and rhomboencephalic formation. D. Failure produces anencephaly. E. Failure produces Tande-Walker syndrome. Dorsal induction and ventral induction are very different processes. Time of occurrence of dorsal induction is from 3 to 4 weeks conceptional age. Time of occurrence of ventral induction is from 5 to 10 weeks conceptional age. Definition-wise, dorsal induction refers to the formation and closure of the neural tube. Ventral induction is a process with less well-defined boundaries. It includes prosencephalic cleavage, CNS midline and phase formation, and mesencephalic and rhomboencephalic development. Disorders due to failure of dorsal induction include anencephaly, cephalocele, Chiari malformations, and dystrophism. In this frame, you can see some examples of dorsal induction defects: anencephaly, cephalocele, Chiari malformations, and craniobrachyschisis. Disorders due to failure of ventral induction include holoprosencephaly, corpus callosum agenesis, multiple midline facial abnormalities, and Dandy-Walker syndrome. These are some examples of ventral induction defects: agenesis of the corpus callosum, holoprosencephaly, cyclopia with proboscis, and Dandy-Walker malformation. So the answer to this question is D. Next question. Which of the following structures arises from neural crest cells? A. Postganglionic sympathetic fibers. B. Postganglionic parasympathetic fibers. C. Dorsal root ganglion neurons. D. All of the above. This figure represents a 35-day embryo. I will use it to illustrate the peripheral nerve structures derived from neural crest cells. We can capriciously divide the peripheral nervous system components derived from neural crest cells into 6 groups. The first group consists of cranial nerve sensory neurons and their neurites. I will now proceed to name the individual cranial nerves, their associate ganglia, and when appropriate, the type of neurons found in each ganglion. In cranial nerve 5, we have the neurons housed in the semilunar or Gasserian ganglion. Microscopically, the neurons in this ganglion are, as you can see here, pseudopolar. You see a single axon that splits. In cranial nerve 9, we have pseudo unipolar neurons housed in the superior ganglion. In cranial nerve 10, we have pseudo unipolar neurons housed in the superior or jugular ganglion. I have now included this figure to stress that at this point the current thinking is that only some cells in the trigeminal ganglion, neurons in the superior ganglion of the cranial nerve 9 and 10 are of neuronal crest origin. The rest of these sensory neurons are of placode origin. The second group of neural crest derived peripheral nerve cells are the spinal nerve sensory neurons. These neurons are the pseudo-unipolar neurons housed in the dorsal spinal root ganglia and their neurites, as illustrated in this frame. In this frame, you can see a transverse spinal cord segment and a dorsal spinal root ganglion. Here we can see an enlarged segment of the ganglion. As you can see, these neurons are characterized by being very large in relation to the cells around them. The small cells are called satellite cells. Another characteristics of these large cells is the central nucleolus. In this new specimen, you can see dorsal spinal ganglion neurons and also satellite cells. In this new figure, you can see rows of dorsal root ganglion neurons surrounded by satellite cells alternating with strands of myelinated axons. The third group of neural crest-derived neurons consists of parasympathetic neurons and their neurites. The distal axon of these neurons constitute the postganglionic nerves. I will now proceed to name the ganglia where parasympathetic neurons are found. The ciliary ganglion in cranial nerve 3. In cranial nerve 7, we find the spheropalatine ganglion and the submaxillary ganglion. In cranial nerve 9, we find the otic ganglion. And in cranial nerve 10 and in the pelvic nerve, we find the ganglia close or embedded in the tissue of the organ they innervate in the thorax, abdomen, or pelvis. Microscopically, as you can see in this specimen, you find neurons that look round despite being multipolar due to the thinness of the dendrites coming out of them. Parasympathetic motor neurons are surrounded by satellite cells, but usually less numerous than those that surround the dorsal spinal root ganglion. In the case of the vagus and pelvic nerve ganglia, the ganglia are usually embedded in the organ, as you can see in this frame. This is an important issue because this is the way to distinguish parasympathetic from sympathetic ganglion. Sympathetic ganglia are not close to, nor are they embedded in the organ. Here you have pancreatic tissue, and here the parasympathetic ganglion. The fourth group of peripheral nerve cells derived from neural crest cells consists of ganglionic sympathetic neurons and their neurites, including the postganglionic nerves. These neurons are found, as you can see in this added figure, in the paravertebral ganglion chain in the thoracic cage, at the neck, in the cervical ganglia, which include the stellate ganglia, superior ganglion, and the internal carotid ganglion. And also, we can find them in the preventricular ganglia in the lumbar region. Here, I have represented the thoracic paravertebral ganglia. The prevertebral ganglia are the celiac, the superior mesenteric ganglion, and the inferior mesenteric ganglion. In addition, we can consider neurons in the adrenal medullary region of the suprarenal gland, also a form of ganglion cells. Microscopically, sympathetic ganglion cells nucleus are usually off-center. The cell is not completely surrounded by satellite cells, and unlike parasympathetic ganglia, they are not surrounded by organ tissue. The fifth group consists of the enteric nervous system, which include cells in the Meissner plexus. Microscopically, as you can see in this specimen, here delineated, you can see the Meissner plexus flanked by the mucosa and muscle fibers. The second enteric nervous system plexus is the Auerbach plexus. As you can see, it is flanked by the circular muscle layer and the longitudinal muscle layer. The sixth group consists of peripheral nerve surrounding cells as satellite cells indicated in this frame, and here in this new specimen, here you can see Schwann cells, and you see here another nuclei of a different Schwann cell. Now I have placed a rectangle and now added an enlarged representation of the area. Here you can see the axon, the nodal ranvier. I have now selected an area of the rectangle and shown an electrophotograph of that area, where you can see the axon and the nodal ranvier. The dark area corresponds to myelin. I am now indicating a Schwann cell. This is an illustration of a myelinated axon, similar to the one we have just shown. It is important to remember that Schwann cells are also engulfing non-myelinated axons. Yet, unlike in myelinated axons, where one Schwann cell is attached to one segment of one axon, in unmyelinated cells, one Schwann cell is involved in one segment of multiple axons. Before leaving the subject of neurocrest cell derivatives, I'd like to mention a controversy about the origin of the pia and arachnoid. Some authors believe that the pia and the arachnoid are of neurocrest origin. Other authors believe that these layers are of mesenchymal origin. So the answer to this question is D. Next question. Which of the following neurotransmitters is not secreted by neural crest-derived neurons? A. Adrenaline. B. Acetylcholine. C. Glutamate. D. Vasoactive intestinal polypeptide. Neural crest progenitor cells become peripheral neurons, as we have just seen. They may become sensory neurons that populate the sensory cranial and dorsal root ganglia with their typical pseudo-unipolar configuration. Here you can see a dorsal root ganglion, and in this enlargement you can see the shape of somatic sensory cells and visceral sensory cells. Visceral sensory neurons tend to be smaller, as you can see here in this specimen. In addition to sensory neurons, neural crest cells progenitors produce motor visceral neurons, some adrenergic, some cholinergic, and other using vasoactive intestinal polypeptide, ATP, nitric oxide as neurotransmitters. These neurons are housed in the sympathetic, paravertebral, and prevertebral autonomic ganglia and in parasympathetic, cranial, or pelvic ganglia, and also in plexus embedded in the tissue close to the organ they innervate. They are also found in the enteric system, as we previously mentioned. Examples of the later two locations are not shown in this frame. Neural crest progenitor also become non-neural peripheral nervous system cells, as we have just seen. They become satellite cells surrounding sensory neurons and also surrounding motor autonomic neurons, and also Schwann cells, which are shown in this specimen. So the answer to this question is C. Next question. Which of the following substances influences neural crest progenitor cell development? A. Leukocyte inducing factor. B. Fibroblast growth factor. C. Nerve growth factor. D. All of the above. This figure shows the factors involved in the transformation of different neurons derived from neural crest cells. The transformation of neural crest cells to sensory dorsal root ganglia is mediated by leukocyte inducing factor. The transformation of adrenergic cells by fibroblast growth factor and nerve growth factor 2. And the transformation of neural crest progenitor cells to cholinergic cells is mediated by growth fibroblast factor and ciliary neurotropic factor. So the answer to this question is all of the above. Thank you very much for your attention.